physical therapy practice help me with my knee pain? Okay, we have to take a look at your knee and what might be going on. If you have a completely torn anterior cruciate ligament, which is one of the main stabilizing ligaments in the knee, the problem might need to be addressed surgically if your activity level requires that. But usually know when it's that bad. But maybe it's a tracking issue. The kneecap is irritated or painful, and you've done a little bit extra activity and now your knee is sore. And why is your knee sore? So we want to take a look and see how well things are moving in the knee region. Is the kneecap, and there's like a little groove, a little dish in your femur, and the kneecap kind of slides up and down in that groove. Now if it's riding up the rail on the outside, that causes irritation, and you can get that kind of riding up the rail from a number of different kinds of things. Some is muscle balance imbalances. Some of it is just the general architecture of how your body's built, and that's your genetic predisposition for certain things. Another piece of the equation is how well your feet and your ankles are moving. If you can only land on your foot a certain way, then you're only going to be using the muscles up around your knee a certain way. And as well, how the hips are moving and your mobility there can also make a difference for the knee. You might have problems from old injuries, from a previous meniscus injury. Those are the little rings of cartilage that sit on the top. So the main supportive bone in the leg is the tibia, and on top of that flat surface are these little rings of cartilage, and they help guide and support tracking of the bone above. And some people back in the 80s and 90s, if they had a significantly torn meniscus, they took it out, and a long time ago surgeons used to take out the whole thing. Now they leave as much as they can, and that can contribute to arthritis issues. When you have a situation like that, we want to try to help improve the tracking as best we can, so that we minimize wear and tear in the joint. So I hope that answers some of your questions for what might be going on with a knee pain situation.